Hi everyone, Dr. Remy from Pain Free and Fit. Today a great exercise for those of you with low back spondylolisthesis. It's both a pain relief self-management or self-treatment technique and a stabilization strengthening exercise. The leg drop off. Hope you enjoy. So the drop off is performed for those people with low back spondylolisthesis whose pain is irritated with spinal extension, meaning that when the upper body leans backwards or the tailbone is lifted to accentuate or increase the curve in the lower back, pain is aggravated. So strengthening the abdominal muscles and opening up the back or posterior part of the spine by flexion, meaning bending the chest forward or tucking the tailbone under and flattening the lower curve in the back, is beneficial. It relieves their pain. So the drop-off can be used in two ways. The first way it can be used is as a pain relief self-treatment technique. Now again, if you don't know what your unique body mechanics are or your proper range of motion for neutral spine, check with your doctor or your rehab specialist. Learn what your unique range of motion is that's pain-free so you don't hurt yourself with this exercise. So for the pain relief exercise, we're going to position ourselves so that the pubic bone is on the bench, but my legs are dropping off the bench. The higher the bench is, the more flexion or the more drop you can get with the legs. And it's not important that the knees are straight. In fact, when they're bent, it allows the pelvis to drop down a little bit more. I'm going to position myself so that I create a neutral spine position in other ranges of motion besides flexion and extension. What I mean by that is if you have a tendency to lean one hip upwards, let's say on the right side, you want to make sure that that right hip is positioned lower. Your right leg is positioned a little longer than your left to keep that right hip down. That's for people whose pain is irritated with hip hiking, let's say raising a hip up to the side. If you have a tendency in your posture or muscle imbalances, let's say your right latissimus muscle is stronger than your left, and you have a tendency to lean slightly to the right and that aggravates your pain, you could actually increase the distance on that side by raising your arm up, grabbing the top of the bench, and that'll help to stretch the latissimus and help to keep the rib cage up for this exercise. If you have a rotational component to your spondylolisthesis pain, meaning that your pelvis twists to one side or another more than the opposite side and that asymmetry, and you have an asymmetrical development of your abdominal obliques or again your latissimus muscles or erector spinae that causes perhaps your pelvis to more easily twist to the right than the left or your rib cage to the right and the left, you want to hold that corrective position for this exercise, meaning that if your pelvis twists to the right, you want to twist it slightly to the left. If your chest twists slightly to the left, you want to twist it slightly to the right. So that besides the backwards and forwards motion or flexion and extension that I'm going to be using with this exercise, your other components of motion or posture or movement disturbance are put into a neutral position. And that includes things such as translations. If you have scoliosis and your rib cage slides to one side, you want to slide it the opposite way. So you're trying to bring yourself back into a more neutral alignment and avoid the typical movement patterns that put stress into the disc, the facet joints, the ligaments, and the other soft tissues in that spondylolisthesis segment. So with that being all set and in neutral, I'm going to allow my knees to drop far enough for me to feel a stretch in my lower back. Now, it's important that you don't go far into the stretch, but only let your knees drop down far enough to feel a mild stretch. My chest is relaxed. If I'm holding my head up, it's going to be more difficult for me to feel this stretch. So my chest and head are relaxed. I'm going to drop down until I feel the beginnings of a little stretch. Even though you could stretch or drop your knees more, you're going to stop where you first begin to feel a little stretch in the back. And you're going to hold that until that feeling of stretch dissipates, resolves, fades away. Then you can drop your knees a little bit more for a second stretch. What you're doing here is you're opening up the back of the spine, the compression of that spondylolisthesis segment that's gone forward, that's created in the back of the spine is stretched out or opened up in this position because as the knees drop down, the tailbone is passively tucked under. You're not using abdominal muscle contraction to do this. You're just letting gravity, the pelvis and the legs drop down in the position. And you could use 3 or 4 successive stretches to stretch out the back of the spine that's compressed with spondylolisthesis. Each step of the way, though, you should make sure that the stretch is very mild, and if you back off of it, meaning if you raise the knees up and the stretch disappears, you're at the right spot. If you back off a little bit and the stretch is still there, it means the stretch was too much. You just want to go to the very beginnings of each stretch. Now, besides the passive stretch I just demonstrated, you can also use an active stretch where you drop your knees to the point of just feeling a bit of a stretch in the lower back, and then you're going to use the opposite muscles to the ones we're stretching. The extensor muscles in the spine are being stretched in this position. We can accentuate or improve that stretch by contracting the abdominal muscles, by tensing the tailbone under. Now, it's important that you don't move the tailbone under. You don't want to decrease that arch more. You just want to tense it that way. If you tense your pubic bone upwards towards your chin and your rib cage down like you're doing an upside down crunch, you're going to feel your abdominal muscles contract, and the stretch will be enhanced in the low back muscles. It's not that you're stretching them further. The range of motion hasn't changed. You're just dropping the knees until you still feel that beginnings of a mild stretch. But by adding the abdominal contraction, as the abs contract, there's a reflexive relaxation of those extensor muscles. You can also use post-isometric relaxation stretches with this, which is if you tense your tailbone slightly upwards from that stretch position, hold it for a few seconds, and then drop it down, you get a better relaxation of those muscles, because muscles, once they're contracted and you get the neurological coordination of them, you can then better drop and relax them. And you could do that 3 different reps at a time. For instance, if I tuck my tailbone upwards or tense it upwards slightly from that stretch position, hold for a few seconds, and then drop, wait for that stretch to pass, perhaps 10 seconds, 15 seconds, 20, 40, whatever it takes for that relaxation sensation to occur. Then I'll tense it up again, hold for a few seconds, and then drop the tailbone and the knees. I'll again feel that stretch as my knees drop just a little lower. The range of motion is increased this time. And then I could do that a 3rd time after that stretch resolves by tensing the tailbone up, holding for a few seconds, and then dropping into a further range of motion. It's important that each drop into the range of motion, again, you're only dropping until you just feel the beginnings of that stretch. Now, you can also use the leg drop as an eccentric strengthening and stretching exercise. And this is a great one that I give both to my patients with spondylolisthesis and online clients. When you lower the tailbone and drop the legs and the low back muscles are stretching, as well as you're stretching the back portion of the disc and the facet capsules, you also could take advantage of that by lengthening these structures under a slow contraction. Meaning that if I straighten my knees and raise my feet slightly off the ground, the extensor muscles in my back, meaning the multifidus, the erector spinae, are contracting. Now, if you remember from previous videos, we talked about the lower levels of the erector spinae muscles at L4, L5, S1. The deepest fibers not only run up and down, but they have a more horizontal orientation to them. So they're responsible for helping to check or hold back that vertebra so it doesn't slide forward. And one of the ways we can increase their strength and their endurance is by doing an eccentric leg drop. So from that top position where I raise the legs, again, I'm making sure that I'm in a neutral position, range of motion. I'm not going past a range of motion that creates pain. As I come up, I'm going to slowly lower. It may take 10 seconds to let my feet slowly come down to touch the floor again. Now, even though that range of motion may only be an inch or 2 or perhaps 6 or 8, depending on the height of your table and your available range of motion that's pain-free, what's happening here is as I'm slowly lowering, those muscles in my back, those extensors, the erector spinae, multifidus, they're contracting, and those long superficial muscles like the erector spinae are lengthening. They're stretching as my feet go down. So remember that we can stretch when a muscle is relaxed, but we can also stretch a muscle by lengthening it under contraction. And the benefit of this, as I'm doing these eccentrics, is that besides stretching the spine out of excessive extension, we're strengthening the extensors so that we're getting 2 benefits here in one exercise. We're getting the stretch, and as we increase the reps as time goes on, if we do this perhaps 3 times a week and we increase a few reps each time, we're going to be increasing the endurance strength of those extensors to hold and check that spondylolisthesis segment, avoiding that anterior forward slippage, helping to decrease low back pain. So run this exercise by your doctor, by your rehab specialist, see if it's right for you, and start enjoying the benefits of the leg drop exercise if your pain is aggravated with extension. If you have any questions or comments on leg drops or any other spondylolisthesis exercise, feel free to write in. Subscribe to our channel to get more videos, learn more about how you can help self-rehab your own spondylolisthesis, And again, if you're looking for a great program to figure out what your body mechanics are, where your posture and movement errors are, where your spinal stability issues are, where your muscle imbalances are that are affecting the stresses that go into your spondylolisthesis segment and aggravate your pain, check out our fast track program for spondylolisthesis. It's at the painfreeandfit.com website. The program will teach you not only how to self-analyze your body mechanics, but also show you a step-by-step program in terms of strengthening the stabilization muscles necessary to get you active again without irritating your low back pain. I hope you've enjoyed this exercise on leg drops for spondylolisthesis low back pain.